Hello there, everyone. I'm Galen Morse, and welcome to Journey to Recovery. We appreciate having you along today. This podcast is entitled The Pros and Cons of Working as a Co-Occurring Disorders Counselor, Part 1. On today's program, we'll talk with Dr. Hal Baumschen about the growing field of co-occurring disorders. We'll cover 10 advantages of working as a counselor with mental health and substance abuse clients. Thanks for joining us today. Our podcast focuses on the co-occurring disorders of mental health and substance abuse. We present a wide range of thought-provoking, hopeful, and positive topics from a clinical yet practical perspective. And we provide a solid, truly integrated and co-occurring disorder resource you can use in your treatment program or in your own recovery. Our host is Dr. Hal Baumschen, a licensed clinical psychologist and licensed alcohol and drug counselor. He's the executive director of the Northland Counseling Services and the clinical director of Northstar Regional Co-Occurring Disorder Treatment Programs. He's an author, a speaker, and clinician with over 30 years of counseling experience. I'm here today with Tim Bodie, Operations Director at Northland Counseling Services, and with Dr. Hal Baumschen, our host at Journey to Recovery. Hey guys.
Morning, Galen. How are you today?
Very good, thank you.
That was a long read, wasn't it?
It was, yes.
It's a journey to the introduction rather than journey to recovery, I think.
Takes a lot to cover.
Yeah. Well, we're going to talk about this field a little bit of co-occurring disorders, and just to remind everybody, co-occurring disorders is where you're working with substance abuse issues, chemical dependency problems, and mental health problems at the same time. And in co-occurring disorders, we try to deal with both of those at the same time in the same setting with the same treatment staff. So that's the most integrated model, and there are a lot of people that are moving in that direction. The field is moving in that direction. So we're going to talk about what that's like. I think Galen asked me before we started, Tim, Galen asked, so are you trying to recruit people, or kind of why are we doing this? But I just thought it was helpful for people who are in the field or thinking about joining this field just to understand it better.
Right. Even if there are some mental health professionals or chemical dependency counselors who are currently practicing but don't know a lot about co-occurring disorders, I think it's good to educate them too about the options and possibilities that are there.
And you know my background, Tim, pretty well, but I didn't start out in chemical dependency so much. I started out more in that mental health part and then integrated more slowly over my career.
Right. So can you talk a little bit about your experience and when you made that decision and what that process was like?
Right. I grew up on the farm in Glencoe, Minnesota, milking cows for a living. And then at the age of 21, I decided to go off to school. And in my schooling and different classes, I found myself being very interested in psychology topics and that sort of thing. Switched my major from broadcasting, incidentally, to psychology. And then as I, worked in the field of mental health, so many people had chemical dependency problems, struggled with drinking or drug use, and I wanted to learn more. Really got going into it when we started Lighthouse in Maple Grove, which is a co-occurring disorder treatment program. And I hired people who knew more about the field than what I did, but I thought, well, I better get myself more educated.
Mm-hmm. And what did you do to get yourself more educated? Talk about your going back to school experience, if you would.
Right. So I had a doctorate degree at that point. I had gone to Northwestern College and I did a bachelor's degree. That was the University of Northwestern in Roseville, Minnesota. And then I did a master's degree at Wheaton Graduate School and a doctorate degree at the Illinois School of Professional Psychology. 21 years after I got my doctorate degree, I went back to Adler Graduate School and did a certificate in co-occurring disorders and got sort of retrained and retreaded to do the co-occurring disorders. So it was a specific certificate to help me with co-occurring disorders.
And how did you find going back to school? Was that a difficult thing for you? Was that enjoyable?
I laughingly always said I hated school, and I wanted the education without going to school. I don't know if that's possible, but I went to school a lot of years. I liked going back, and I was not the typical student because I was older. And we're going to talk about this later, but I was one of the rare guys in the classroom. One of the things that I enjoyed is everybody brought a laptop, and that was true when I went to Adler, but it was not true when I did my doctorate or my master's degree. And we didn't have laptops. And so I enjoyed having my laptop, and you could get the PowerPoint presentation that the teacher was using, the instructor was using, right on your laptop and kind of follow along. And then I did online auction buying, or checked Facebook like all the other students, in the classroom. So I found that pretty amusing.
Yeah.
Never did that in my graduate program.
You weren't playing Dungeons and Dragons
No,
or anything like
I wasn't
that.
doing
Just
that,
shopping.
I asked the instructor, please be quiet. I'm trying to bid here, that sort of thing.
Right.
Schooling was a necessary thing. I think when people are getting into this field, what can I do with a high school diploma, or what can I do with a bachelor's degree? This field doesn't lend itself too well to those. You really need to think about an advanced degree in order to get into the field of mental health, a master's degree or a doctorate degree. You can do chemical dependency counseling in the state of Minnesota with a bachelor's degree, but then at some point, I think we're going to move in this state, we're going to require that you get a master's degree to work in the field of chemical dependency, or they'll do a couple of layers where it's a lower level license at a bachelor's degree with a higher level license at a master's degree. Mm-hmm. And I do see that on the horizon. I think that's coming. Mm-hmm. What do you think? Should we talk through some advantages of being in this field?
Yeah, let's do that. So we're going to start, we're going to talk today about 10 advantages of working in mental health and substance abuse. So let's get started with that. One advantage is to be able to have work.
Right. There's so much need in this field that you're pretty much, you can count on, I'm going to have work, especially if this country moves to where everyone in the country is insured. Everybody has health insurance, and the health insurance plans are going to stipulate that if you have a mental health problem or a chemical dependency problem, the insurance coverer is going to have to make accommodations for your illness. An additional reason that you're always going to have work in this field is some of the chemical dependency problems we're not trying to send those guys to jail. We're trying to get them treatment instead of incarcerating them. And so because the states across our United States are moving in that direction, you're always going to have work because we're always going to have people we're trying to keep out of the prison system or the jail system and get them some good treatment.
Right.
It's also projected by the Bureau of Labor Statistics, the BLS, that the fields of mental health and substance abuse are going to experience rapid growth over the next few years. And they're talking about 31 or 30, I've read, 29, 31, I've read them all, just depending on what year you're reading this. 31% growth in this field over the next few years.
So there certainly are, sounds like opportunities for employment for people who are interested in this type of work.
Right. And what this is like as the operations director of our agency, Tim, we're always looking for somebody, it seems like, and we want good quality people, and you often have an ad going, so we're recruiting almost all the time, it seems like. Right.
And it has been difficult to find people with that dual licensure, both mental health and substance abuse. So we are looking for that kind of person.
Backing up one, have you personally ever had trouble finding clients or finding a job?
Well, I've never had trouble finding a job because I've always been self-employed. I've not always liked my boss, so to speak, but I've never had trouble finding work. And finding clients, I would think the answer to that is yes, but not now. In the past, maybe I concerned myself with finding clients. but this field has grown. More people are comfortable coming for mental health services, and more people are in need of chemical dependency treatment, co-occurring disorder treatment. So for right now, boy, there's no shortage of clients, no shortage of work, Galen.
Okay, let's talk about the second one, the second advantage of working in this field, which would be to make a positive impact on individuals and their families.
This probably rises to the top in terms of what people say about this field and why they enjoy it, why they want to be in it. I get to help somebody. We make a difference in somebody's life, and that feels good. We help people learn how to cope with their disorders or disabilities or overcome emotional and mental challenges. And we teach skills to reduce symptoms and prevent relapse. I've talked about that on this program before. Those are the two primary reasons that we do treatment, as we're trying to reduce symptoms and prevent relapse.
Right.
And then we get to instill hope. A big thing for me is to try to encourage somebody, support them, and inspire them to be hopeful about the future. Your future's bright. You don't have to live like this. You are going to get better. We bring hope and healing to families. A marriage is restored. A life is saved. Somebody stays out of jail. I feel good about that.
Mm-hmm.
I hate to bring this up, but I suppose not everyone gets better, do they?
Well, that's a sad but great point, Galen. We are going to talk about that next week when we look at disadvantages. It's the painful part of this. The good part is, hey, people get better, and I feel good about my role in that. And then the sadness is not everybody does. Somebody might pass away, go back to jail, relapse, have another bout of depression. So, yeah, it's a very sad thing. It's one of the disadvantages. Makes it hard to be in this field. On the other side, what we were talking about is I feel good about helping people. Mm-hmm. Somebody got better, you know. There's that little thing, you've probably seen it, where this guy's on the beach and he's throwing, it's just like hundreds of starfish on the beach, and he's throwing them back in the water because they can't live on the shore. They've got to be in the water. And some passerby comes along and says, "What are you doing?" And he's like, "I'm throwing these back in because they can't live on the beach." And the passerby says, "Well, you can't help. Look how many of them there are. You can't help everyone, can you?" And he's like, "No, but I can help that one." And that's how it can feel sometimes, is that I help that one.
Mm-hmm. Let's talk about the third advantage, which would be to make a positive impact on the community.
Right, and it's like the second one that we talked about. You help an individual, and in so doing, maybe you help their family, their church, their community by helping an individual. And one of the things that counselors do, we help treat symptoms, but we're also helping people prevent relapse. Maybe we're giving some education that help people not get into mental health trouble in the first place, or substance abuse trouble in the first place. Mm-hmm. So we're making the world a better place. A man told me that he missed both of his parents' funerals because he was in jail. Very sad thing. But now he was back on track, so he was going to be able to go to his daughter's wedding or go back to work, you know. So even though he missed some things in the past, I think we're helping the community, we're helping him.
Mm-hmm. Absolutely.
Are some communities afraid of having mental health or chemical dependency treatment in their communities?
Right. Tim got involved in this where we had a sober house in one of the communities, and the people, they're afraid of what that would be like. Are you going to bring chemically dependent people into the neighborhood, and what will that be like for our property values? Do you want to talk about that, Tim?
Yeah, so a lot of times I think, people are opposed to this kind of thing because they really don't understand what it's about. And they have because they have all these unknowns. They're afraid of those, and so I think if people would really understand, that would help them. But there also can be the not in my neighborhood mentality, which is, I think these programs are great. I think what you're doing is great. I just don't want it next door to me, and that's hard to combat.
Do you remember that fairly long letter that was directed to me, but I know that you read it and helped write a response to this woman in another community where we have a sober house, and she had a lot of fear about just things that seem preposterous, like those guys are going to be outside smoking and somehow that's going to influence our child or something.
Right. And, people tend to think that somehow these guys are worse than another neighbor they might have down the street, when in reality, they could have a neighbor who sits out front and smokes or has some kind of a drug problem. They maybe just don't know about it.
And if people have a drug problem that's current in any of our homes or in any of our facilities, they are usually upgraded to another level of treatment. They're not allowed to stay and continue to use alcohol and drugs in our treatment facilities.
Right. And the guys and gals who would be in a sober home, for the most part, they're people who want to get better. They want to recover. So that's a positive thing.
Which brings us to our fourth point. This work is highly challenging and creative, and every day is different. Would you've watched my schedule? Would you kind of see it that way?
Yeah, we sometimes have to check with each other around the office to say, like, where's Hal? What's he doing right now? Because his schedule does change every day, and to some extent, that's the nature of working in a profession that deals with people.
Right. Yep. Different people, different problems every day. I get to be creative in several different ways, including the counseling. I think you never know exactly what's going to walk in the door. And so there's always an opportunity to experience something that's unique and different and challenging.
Right.
In the field of mental health and substance abuse, would you say there are more men or women going into the field, or is it equal?
When I started at Wheaton Graduate School, again in 1985, I think it was, 1985, maybe my class of 25 was about half men, half women. When I went to Adler Graduate School 21 or 23 years after that, the ratio was maybe 2 men and 18 women in my class of 20. So, yeah, very different. Very different. So I would say it's more women going into the field. The statistic that I read was 68% women, 32% men going into the field of substance abuse and mental health.
So would you encourage men who have an interest in this field or are working, as we said before, in mental health or chemical dependency to pursue something in co-occurring disorders? Is there a need for men?
Right. There's just a need for men and women that are educated and concerned about people. So I would encourage both. Yeah. But sure, we'd love to have men in the field and women too. So there's a need for them both. So if you're thinking about it, jump into the field, check it out, contact some colleges and some graduate schools and take a look at this field.
Yeah.
Before you guys move on, allow me to jump in here for a minute and direct our listeners to some of the resources that are available on our website. We're always adding new materials such as podcasts, blog articles, lessons you can use in your center, and we invite you to share this resource with friends and family who have an interest in recovery. Also, check out Dr. Hal's Journey's Co-Occurring Disorder Lifestyle Resource Manual. This manual is packed with clinical wisdom gathered over 30 years. It's a full-color and easy-to-read resource containing hundreds of treatment ideas and strategies that work. You'll find this resource thought-provoking, hopeful, and positive. Here's Tim to tell you how you can get your copy.
Thanks, Galen. To purchase a copy of the Journey's Manual, visit journeytorecovery.com and click on Workbook in the top menu. You'll find a description of the manual and an option to purchase a copy for yourself or your treatment center. Let's go on with some more advantages to working in the field.
Can I interrupt you for a second?
Sure.
I think someday I want to talk about the workbook, and it's kind of appropriate here because it's helpful for clinicians to use the exercises in the workbook, hand them out to your clients. And so if you're in this field and you're regularly chatting with clients or working with them in a group, there's some great exercises, checklists, things in the workbook that are helpful.
Yeah, good point. All right, number 5, the fifth advantage of working in the field is you can earn a decent income, right?
Right. Probably not a get-rich scheme, but you can earn an income. It's probably pretty close to other fields of study where you have a master's degree or something. If you have an MBA, you might make more than the typical counselor. But again, I think you can make a good income here. A couple of different ranges that I looked up. If you're a licensed alcohol and drug counselor with a bachelor's degree, you might be looking at $34,000 to $61,000 a year, $34,000 to $61,000 a year. I know that's quite a range, but that would depend on where you are, what state you're in, what city you're in, and how much experience you had. And then the mental health therapist, kind of similar ranges, $38,000 to $60,000. That would usually require a master's degree, and a clinical supervisor might make a little bit more, maybe up to $71,000, and then a licensed mental health counselor, again, $50,000 to $75,000, even $100,000. You might be including some PhD or doctoral level people at that point.
I have a feeling money isn't the primary motivation for most people in this field, but it can be an attractive benefit.
Right. Yeah. I need to feed my family and take care of my responsibilities. So, yeah, it's an attractive benefit. Most people don't go into this field for that reason. Right. Yeah.
Let's talk about advantage number 6, which is you can work for yourself. You can be your own boss. That's something, Dr. Howell, that you've done.
Right. Yeah, I run my own practice and have done so really most of my career. My dad always said, he was a farmer. My dad always said he went into farming because he didn't want to work for anybody else. So he was his own boss, and he was happy about it. I think people going into this field, some people work for others in practices, and about 35% of all psychologists open their own private practice. So there are some people who want to be their own boss. But even when you work for someone, you have a lot of freedom to do things kind of the way you want to do when you're chatting with a client or something. You have a different options available to you.
Yeah. So, as we said, you have been self-employed, your own boss for a long time. How did you come to that decision, and what's that been like for you?
I heard one time that an entrepreneur is somebody who works 60 hours a week because he refuses to work 40. And that kind of fits me, I'm not gonna work 40 hours a week. I'm gonna work 60, 65 maybe. Yeah. So I started out in 1985 with a master's degree and opened a practice. Within a year of that, from 85, 86, I started a practice. And so I pretty much have worked for myself or designed practices right from the beginning. But almost immediately, Tim, I hired somebody to work with me. I didn't want to work alone. I'd hire other counselors or secretary, receptionist, billing people. And so I kind of got into the field that way, running a practice in addition to being a counselor.
Mm-hmm. So can you talk about some advantages to doing that, to running your own practice?
Working 60 hours a week instead of 40. I think there's more opportunity, but there's higher risk. That whole risk-reward ratio is really true here for running your own practice. So there's some benefits and some rewards, choosing the people that you want to work with, and maybe finding the niche market that you want to be in instead of having that assigned to you by your employer. So I think there's some advantages. I wouldn't say making reams of money was one of the advantages. I would say that I've struggled sometimes to make sure everybody else got paid and maybe worried about it. That would be a disadvantage. I worry about things that other people are doing and not just my own. My own caseload. I worry about other people's caseloads as well.
Let's go into number 7, seventh advantage, which would be to develop your own character.
This one you don't really read much about, but I do like this one. Just the 40,000 hours that I've sat with people over the years, And I say to myself, like, I don't want to do what he did. I don't want to treat my wife the way that guy treats his wife. I don't want to be disrespectful like that person. I want to be different. Or they'll do something that I'm really proud of, like, well, I want to do that in my life too. So it's been 40,000 hours of working on them. And in addition, I think I've worked on myself, developed my own character, helping me to become more responsible, kind, loving, patient, compassionate, understanding.
You've touched on some things, but can you give us some specific examples of how that's worked in your life?
Any good stories you can tell?
I just that general thing, like, don't be that guy. I say that a lot to myself. Yeah. I wouldn't say that to the client, maybe, like, I'm not going to treat my wife like you treat yours. I definitely remember one time, Galen, where I listened to the story and was so grateful for my wife and her gracious understanding toward me that I immediately left the clinic and went and bought her flowers.
Nice.
So this is good for the wife, for the spouse, as well as the counselor.
For all of your relationships, I think, for your children, for your friends, for the community in general. Yeah, it's a good field to be in because we're sharpening our own character, trying to be more patient, kind, and understanding, and we're reminded of it all day long.
Thank you. Let's talk about the 8th advantage of this field, which is to work with a team.
Yeah, this is our 8th advantage here, being able to work with psychiatrists, other social workers, probation officers, techs in the residential treatment center. So I'm around people regularly, and it's been one of the blessings of being in this field, good contact with other professionals.
Who on that list do you really interact with?
We have a psychiatry meeting every Thursday morning for an hour, and I meet with a psychiatrist on Wednesday evenings for a team meeting. And I definitely, I've got a couple of other staff meetings that I do, and I do quite a bit of training. So I'm meeting with interns every week. Every week I meet with some interns. So just a wide variety, Galen, from psychiatrists to interns, I would say.
So speaking of training, that's another of our advantages is that you, at some point, will have the opportunity to train others in the field.
Speaking of specific stories, I remember being a graduate student practicum at the Ray Graham Association for the Handicapped, that's what it was called, in Elmhurst, Illinois. And while I was there, there were 4 or 5 other practicum students in their practicums with me, and one of them said, "Boy, I hate being a practicum student because you don't get paid and you got to do all this grunt work." And I said, "Yes, that is true, but there's coming a day when we will graduate, become leaders and team leaders and run practices and become managers and programs. And from that point forward, practicum students will be working for us." And that turned out to be true for me.
Yeah.
I've had a lot of students over the years, probably upwards of 50, maybe even more than that over the years. It's been great to train them and to work with them. And I've just had some top shelf people.
Mm-hmm.
You've talked a little bit about training. Are you doing any training currently?
I think we have two interns, practicum students that we're working with now, and 3 more coming in about a month and a half. So there'll be 5 for this year. And then in some of the other settings where I'm at, we have some trainees there as well. So, it's usually 5 or more per year that I have contact with.
And can you talk a little bit about that process of training, what it is that you feel like you can impart to these practicum students?
Right. All right. That's a good question, Tim. What do I impart? I just want to talk about their experience for a second.
Sure.
Most of them are required to have 880 hours of practicum experience in a master's degree program. So what that means is they're set up in their schedules to get credit for working in one of the treatment centers or one of the counseling practices. So they look around to find a counseling practice or a treatment center that they want to work with, and they do that in advance. Many of the students start looking in January or February for the following September, and they find a practicum and they have to serve 880 hours. Most of those internships in our state are not paid for or not paid. In that practicum, they have to experience certain things like contact with clients, maybe do some group work, learn about charting and somewhat about billing, but good record keeping is part of that. And then all of the ethical concerns that come up with being a counselor, and you need training in ethics, making sure that you are HIPAA compliant and handling medical records appropriately. All of that's appropriate. And I think part of what we've imparted, or what I've imparted, is helping them to get a good understanding of the field, learn some cognitive behavioral therapy interventions, and then help them with charting. We use an electronic medical record system, which you're aware of, and make sure that they're ethically and professionally compliant.
And I see that those practicum students who come into our program and who you work with also benefit from the experience that you've had. You've talked about, your 40,000 hours, and there's certainly an opportunity there for you. And again, we're talking about training others, opportunity for those in the field to pass along some of that experience to those people who are coming up into the field.
One of the things that's fun for me is that workbook we were talking about earlier, and I have a couple of those, and we use my material in the residential treatment center and some of the intensive outpatient treatment programs, and even in some we use some of my handouts and other literature that I've written over the years in the counseling center. So when I'm talking about ADHD, I can tell the practicum student, grab that brochure that I wrote on ADHD or depression or anxiety or worry or stress, and us have a lot of that they can draw on, and they find that helpful. They want a curriculum, and we have one. So I think we have good training materials for the counselors.
Okay, let's go to our last advantage here, number 10 for today. Flexible work schedules. Is that an advantage or a disadvantage?
Yes, I get to work. It's an advantage, disadvantage. I get to work whenever I want, day or night, as long as I want to work both day and night.
Right.
Yeah, I work hard. Many people in this field have to work schedules. Maybe they have some flexibility when they want to come in. We have therapists who come in a little later. They try to work their schedule around traffic. Also, when we talk next week about disadvantages, sometimes you can get assigned to work in the evening, or you have to work certain nights or weekends and that kind of thing too. But later on, I think there's some flexibility. You need a day off or something like that, or I don't want to work on Tuesdays because I don't have childcare that day. You can find a schedule that'll be flexible that way.
Right. Dr. Howell, can you talk about some traits that are necessary to be a good mental health or addictions counselor?
You want to have knowledge of human behavior and human performance. You want to be good at diagnosis and treatment, and all that needs to be learned over time, of course, but it is important. And finding or knowing about individual differences, individual abilities, knowing about personality development and personality styles. It's helpful to learn about motivation and, again, learning styles that people have. And then we do a lot of work with assessment, so diagnosis and treatment for people.
So specifically, what skills do therapists really need to be effective?
Listening is a nice skill. I actually have a therapist currently, and he came to me and said, can you help me with my counseling? And so one of the things that we went over is, why don't you go back to your early training where they were teaching you how to be a good, empathic, compassionate listener. Do less teaching, less talking, and more listening. So it's a real important skill. Another one is having a sense of humor. I just think it goes a long way in whether you're directing a play or working behind the board as an engineer. I think keeping a good sense of humor is really helpful. This is a tough field, so if you can laugh a little bit, it makes it a lot easier. Clint Eastwood said, take your work seriously, don't take yourself seriously. I think that's good advice. And then a client of ours said, if you learn to laugh at yourself, you're in for a lifetime of good material. I like that. That seems right to me.
Seems right to me, too.
Yeah. And one other thing that we might say is helpful for people is just having a sensitivity, being sensitive to what other people are going through, and sitting with them, being compassionate and understanding. Thanks, Galen.
Dr. Hale, what are some of the activities that someone in this field could expect to do in their job?
I think sitting with people, so establishing and maintaining a therapy relationship, and then you have to document it. So that is one of the disadvantages of this field, and we're going to talk about that next week when we chat through some of those. But it's really helpful to be able to establish a working relationship. It's an activity that you spend your time doing, and then you're going to spend some time doing organizing, planning, and recording of what you did or documenting what you did.
All right. Well, I'd like to say thanks to everyone for listening to today's podcast. We're discussing the 10 advantages of working in the mental health and substance abuse field. We certainly enjoyed having you along with us. I ask you to join us next time when we will consider 10 disadvantages of working in the co-occurring disorder field. Also, we invite you to check out our resources on the web at journeytorecovery.com, where you can download other materials that will help you develop skills to identify emotional problems, reduce symptoms, and prevent relapse at journeytorecovery.com. We've been visiting with Dr. Hal Baumschen, a licensed clinical psychologist and licensed alcohol and drug counselor. I'm Galen Morse. Thanks for listening to today's program. See you next time on Journey to Recovery. And remember, recovery is a journey. Enjoy the ride.